These comments suggest that you must have to be thin to have an eating disorder, but this is far from the truth. Eating disorders are not a rich white woman's disease, though many people stigmatize eating disorders, which create these beliefs. Eating disorders affect people from all demographics of all ethnicities at similar rates. People of color, especially African Americans, are significantly less likely to receive help for their eating issues. Black teenagers are 50% more likely than white teenagers to exhibit bulimic behavior, such as binging and purging. In fact, in a study of adolescents, researchers found that Hispanics were significantly more likely to suffer from bulimia nervosa than their non-Hispanic peers. The researchers also reported a trend towards a higher prevalence of binge eating disorder in all minority groups. People of color are significantly less likely than white participants to have been asked by a doctor about eating disorder symptoms, despite similar rates of eating disorder symptoms across ethnic groups. Eating disorders affect people of all shapes, sizes, genders, and races.
To think like, oh, that would never happen to me. Any one of us could develop an eating disorder. We're no different.
Eating disorders in people of color may be, in part, a response to environmental stress like abuse, racism, and poverty. Therefore, given the multiple traumas that people of color are exposed to, they may be more vulnerable to eating disorders.
What the person is looking for is a sense of belonging, of connection, of love, feeling worthy or valuable, of feeling safe, or have an experience of trauma. Again, we might feel out of control, powerless, and helpless. Trauma can really prime us to develop all kinds of maladaptive patterns. And eating disorders really can operate in the same way. People can use them to numb, to get out of a feeling, or for some it's to create a different feeling state. But for all of them, that common thread is that underlying anxiety or pain or discomfort, that suffering that they're trying to alleviate.
Eating disorders are unrecognized, underrepresented, underdiagnosed, and undertreated in men. They are commonly masked by the socially constructed idea of masculinity that men must hold in their feelings to avoid the perception of weakness. A study found that men with anorexia nervosa may face harsher stigmas from their peers or go undiagnosed because of the stereotype that anorexia nervosa is a female disorder. Men make up 15% of cases of anorexia nervosa, bulimia nervosa, and binge eating disorder. A recent study found that 22% of young men turn to dangerous means to bulk up muscle with disordered eating behaviors. The National Eating Disorder Association says that 10 million males will be affected in their lifetimes. Eating disorders are both a physical and mental illness. Eating disorders are not for attention, and the patient is not to blame for their disorder. Why can't you just eat? Is a complex question, as eating disorders are also complex diseases of the brain. The stigma around eating disorders is growing, causing less and less people to reach out for help. Social media platforms have a significant influence on a person's thoughts, feelings, behaviors, and overall mental health. It plays a major role in low self-esteem, self-blame, and the comparison of unattainable beauty standards. Different bodies and races are not represented in the media, causing people to compare themselves to the bodies shown in the media. Online influencers with millions of followers are using Photoshop to manipulate their pictures beyond recognition. Their young audiences are negatively influenced by the beauty standards these famous people are creating, even when their bodies have been completely altered. Not only does society and social media have a great impact on the stigma of eating disorders and the cause of eating disorders, but doctors and medical staff do as well. Eating disorders, even in extreme cases, are not always visible. Anybody can struggle with an eating disorder, and the fear of being rejected by doctors is why people are not reaching out for help. When presented with identical case studies demonstrating disordered eating symptoms in white, Hispanic, and Black women, clinicians were asked to identify if the woman's eating behavior was problematic. 44% identified the white woman's behavior as problematic, 41% identified the Hispanic woman's behavior as problematic, and only 17% identified the Black woman's behavior as problematic. The clinicians were also less likely to recommend that the Black woman should receive professional help. Hospital staff overlooked the concerns of eating disorders due to not understanding them, causing the staff to prejudge patients, dismissing their illness, and providing inadequate care. Hospitals are socially marginalizing eating disorder patients, and they are invalidating the distress of their patients. My close friend received inadequate care at the hospital while in treatment for anorexia, and here is her experience.
Hi, my name's Olivia, a close friend of Julia's. I'm going to be talking about my experience at a hospital where I received eating disorder treatment. So it was summer of 2019 when I had gone to the hospital for what I thought was a normal trip to the ER. The week prior to me going to the hospital, I was experiencing extreme fatigue. I was lightheaded and almost fell over a few times. And I always felt so dehydrated no matter how much liquids I was actually consuming. I went to the hospital on July 23rd because I had woken up with severe stomach cramps and throwing up, which I know sounds very gross, for about 4 hours straight. So I knew I needed to go. Days prior to me going to the hospital, I was doing normal activities like swimming, going to work, but my body did feel extremely weird, and I did notice that. When I was in the hospital and was seen by a doctor, he was extremely shocked that I had not come earlier in the week. Little did I know he was referring to the fact that I was soon to be an organ failure. My mom and I looked at each other and I nervously laughed, which is very typical of me. I was very confused because I thought I had just gone to the ER for some fluids and I'd be on my way, but that wasn't the situation. It wasn't until the next morning that I was admitted and assigned a team of doctors. The way in which the 7 doctors entered my room and greeted my mom and I was very intimidating. The process of stretching your stomach back to normal is extremely painful and a timeful process. I was there a total of 14 days and was given a specialist team that I would follow up with weekly. 3 years later, and I am still working on my relationship with food with my team. They have helped me so much in accepting my bad habits with food. I had 2 dietitians, a psychiatrist, a gastro doctor, and a few others I don't remember the names of. I was told that morning I would be receiving eating disorder treatment. They had explained to me what the protocol was, and the list included things like the nurses' names who would eat all 3 meals with me. When I was served 3 meals, I had to eat undressed and finish my plate in a certain amount of time. I also had night nurses who would sit and make sure I was not working out. If the plate was not entirely eaten, I would then be forced to have a feeding tube placed. All of these rules being read to me were incomprehensible. I knew I was a small person. I was always called skinny my entire life, but I refused to believe that I had an eating disorder. I was 17 this summer, so legally the hospital had every right to have me follow this protocol. Around this age, though, I was experiencing extreme depression and an undiagnosed bipolar disorder. I knew my relationship with food was unhealthy, but I had always blamed it on being tired or not hungry. There were certain days I would have a singular grape and a sip of juice in the morning and be fine all day. However, I could not accept that I had this diagnosis of anorexia. I always correlated eating disorders to people who restricted themselves from certain foods or calorie counted, or even looked in the mirror and saw a fat person. That was not my experience, so I did not think I had to follow this protocol that was being forced upon me. The next few days were really hard for me. I was not finishing my meals in the time that was given, so I would have the tray literally grabbed out of my hand and given an Ensure to chug instead. I was so scared of the feeding tube, and the nurses knew that, so they constantly used that as a threat. Olivia, I'm putting a 2-minute timer, and if the Ensure isn't gone, the feeding tube is going in. Some of the nurses were nice, but I also had a few nurses who really scared me. After my time at the hospital, I was able to talk with the head adolescent doctor and tell her some of the awful experiences I had while under their protocol. Though I hated the fact that I had to go through those 2 weeks at the hospital, I am very happy it has happened today.
Eating disorders are serious, potentially life-threatening conditions that affect a person's emotional and physical health. They are real, complex, and devastating conditions that can have serious consequences for health, productivity, and relationships. Eating disorders affect your cardiovascular system, in which low-calorie consumption causes your body to break down for protein for energy. Pulse and blood pressure drop as the heart has less energy to pump blood, and the risk for heart failure will continue to rise. Purging and laxative use depletes your body of electrolytes, which can lead to irregular heartbeats, heart failure, and death. The cardiovascular system also reduces its resting metabolic rate while the body attempts to conserve its energy. Food restriction and purging interferes with your gastrointestinal system as well. It can lead to indigestion, stomach pain, bloating, nausea, blood sugar fluctuations, blocked intestines, and bacterial infections. Long-term inadequate nutrition can weaken intestinal muscles and leave them without the strength to propel digested food out of the body. Laxative abuse can damage nerve endings and leave the body dependent on them to have a bowel movement. Binge eating can cause the stomach to rupture, and vomiting can cause the esophagus to rupture and parotid glands to expand in the face. Other effects of malnutrition and purging on the gastrointestinal system include pancreatitis, mechanical bowel movements, intestinal perforation, and other infections. The neurological effects of eating disorders include difficulties concentrating, obsessing over food, difficulty sleeping, numbness and tingling of extremities, seizures, muscle cramps, dizziness and fainting, and an increased risk of sleep apnea. Eating disorders affect the endocrine system, in which sex and thyroid hormone levels drop, menstruation can stop, and there is a greater risk of osteoporosis and a resistance to insulin. Prolonged dehydration can result in kidney failure, and those with eating disorders are often cold. Malnutrition can decrease infection-fighting white blood cells, and purging can decay teeth and cause mouth ulcers. Without treatment, up to 20% of eating disorder cases result in death. Eating disorders are very serious and complex disorders, and the patient is not to blame. Though the stigma may say otherwise, these patients cannot just eat to recover from their illness. It is crucial that we eliminate the stigma surrounding eating disorders so that patients struggling with them can get the help they need and are not prevented from getting this help.